Welcome back to Nasdaq Trade Talks. I'm your host, Jill Malandrino, Global Markets Reporter at Nasdaq. We're coming to you live from day 3 of the Singapore Fintech Festival. And joining me for this segment, we have Cole Sirueck. He's the co-founder and CEO of DocDoc. And this company is the first patient intelligence company, as the name might imply. Cole, it's great to have you with us. And what's really unique about DocDoc is the value prop that you bring to healthcare and the industry globally, specifically for patients and for doctors. Tell us more.
One of the biggest problems in healthcare, and the reason you have such a giant problem with medical inflation globally, is because the patient has no empowerment. Mm-hmm. When you get sick, how do you find a doctor? Ask a friend, maybe go to another doctor and say, do you know anybody good? There's no data, there's no intermediate markers, there's nothing that you have that allows you to make an informed decision. Well, that's a problem. In any market where there's no information to the consumer, there's going to have huge inefficiencies, like medical inflation, like the fact in healthcare that what you pay for healthcare and what you get in terms of outcomes aren't even related.
Right.
So that's because of an information arbitrage. So we are solving the cost-quality dynamic in healthcare by empowering patients to make informed decisions using data to select better, more relevant care for their unique needs.
So if they have the right data, the right clean data sets, that's actually, at the end of the day, it's going to improve the quality of care. It's also going to improve the quality of cost, particularly if you look at it from a preventative medicine perspective.
Yeah, but I mean, preventative is a derivative. Let's just talk straight up front.
Okay.
The way the current healthcare landscape works, it's like walking into a jeweler and the giant flawless diamond and the small diamond with a ton of inclusions. The flawless giant diamond is cheaper in many instances than the flawed tiny diamond, because you as a consumer have no way to know. There's nothing in the status quo globally that allows you to make informed decisions. So what do? You associate quality with cost. Oh, I just must go to the most expensive hospital,
right,
most
you
expensive
pay for
doctor.
what you get for that mantra, right?
That must be true. But in healthcare, it's not true, because there's no way for you to define quality. So we are revolutionizing healthcare because we are giving the consumer the data they need to make informed decisions about care. And that's going to have profound implications for insurance and pharmaceuticals and hospitals and doctors. And it doesn't need to be necessarily negative or create channel conflict. Mm-hmm. There's room for massive wins here.
Right.
Kind of across the board.
So how is the healthcare industry being disrupted by artificial intelligence?
So that's kind of a hoax. A lot of people, we're an AI company.
Right.
Right? And so very rarely do you see somebody get on stage and say, well, I'm an AI company and AI is a hoax. AI is so far overblown from a marketing point of view versus its practical reality that it's like somewhere near photon torpedo or time machine in terms of being able to get into the market and make a huge difference. What's really happening now is narrow AI, that a lot of it's around structured data. And what you got to realize in healthcare, we are so far behind in terms of consumer empowerment and the basic things we need to make a market efficient, that just by solving those problems, by using structured data and clean data, you can massively transform the industry. You don't have to get into AI chatbots that are using machine learning. That's 1% of the problem, 99% is consumer empowerment.
And that's the whole thing, though. But going back to the consumer, will they be able to understand this? And that's education, and that's
Jill, that's the trick. And look, so what's your I'm going to assume that you're not a mechanical engineer.
That
Fair
is
enough?
correct. Yes.
All right. But when you go to buy an automobile, can you walk on the lot and you can go online and you can look at crash test results, fuel efficiency, resale value, you can compare different models, you can look at headroom. There's all these things called intermediate markers that allow somebody who's not a professional race car driver or a mechanical engineer to buy an automobile.
Right, which is reasonable because we're not experts in every single industry.
So the majority of the other industries in the world have formed intermediate markers that allow their consumers to make informed decisions. They didn't demand their consumers become experts. Healthcare, because of the way the insurance industry and the employers and governments pay for care, the consumer has very little power. And because the consumer or the patient has very little power, the industry hasn't responded by creating intermediate markers that allow you don't have to be a pharmacist to make an informed decision about which medications you take. You don't have to be a doctor to make a decision about your own health care. That's what we do. When we say patient intelligence, we're creating intermediate markers around outcome, price, and experience that allow the lay consumer to operate in an industry as if they were an MD, PhD.
When do you think all this will actually, consumers will have this available to them?
It is happening right now. We've done 13 million cases, and it's working, and it's brilliant, and it's beautiful.
All right, well, thanks so much for joining us.
Thanks for your time, I really appreciate it. Take care.
Thank you. And thanks for joining us on Trade Talks throughout the day. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.